you are tuning in to AWANI Tonight with me, Cynthia Ng. 3 states to enter Phase 3 of National Recovery Plan on Wednesday. And as more sectors gear up to reopen, can vaccination be made mandatory for employees? That's coming up. Perlis, Sarawak and Labuan will move to Phase 3 of the National Recovery Plan on Wednesday. In a statement on Facebook, Prime Minister Tan Sri Muhyiddin Yassin said all 3 states have shown good performance and met all the necessary indicators under the NRP. Based on the initial criteria which the government set in early July, Phase 3 will allow almost all industries with fully vaccinated staff to operate at full capacity, while educational, sporting and some social activities will be permitted too. In the same statement, the Prime Minister said he will announce the relaxations for fully vaccinated individuals soon. There are concerns over SOP relaxations following a recent report by the Centers for Disease Control in the United States, which found that fully vaccinated people with breakthrough infections can spread the more contagious Delta variant. Minister in charge of vaccination, Khairi Jamaluddin, says the government is taking note of the recent developments and will ensure a diligent approach.
We've considered some of these developments from other parts of the world in order to prepare for the benefits of those who have been fully vaccinated, to ensure that we do not open up too quickly.
He urges Malaysians to continue to practice stringent SOPs even though they are fully vaccinated.
We have to accept that with the rise of the Delta variant, that COVID-19 will become more endemic, or rather it's out there in the community. So because of that, I think it's a combination of vaccination as well as other public health measures. It's very, very important that even though we are fully vaccinated, that we continue to practice non-pharmaceutical interventions like mask wearing, good ventilation, physical or social distancing, as well as personal hygiene.
Some 97% of adults in the Klang Valley registered for vaccination have received at least 1 dose of the COVID-19 vaccine. According to Khairi Jamaluddin, attention will now shift to the effectiveness of the vaccination exercise, and the key numbers to look out for are hospitalization and death rates. He said improvements in the number of cases are expected in the next few weeks, as more people would be fully vaccinated in Kuala Lumpur and Selangor, the epicenter of the pandemic.
We also know that vaccination continues to be important, even with the Delta variant. In Labuan and in Sarawak, we are seeing cases of hospitalization and deaths that have dropped. And this suggests that the vaccination in Labuan, for instance, a lot of Pfizer was used. In Sarawak, a lot of Sinovac was used. But both types of vaccines have, to some extent, succeeded in reducing hospitalization and death rates in those 2 states, which have very, very high percentage of the population that has been vaccinated already. We hope to see this in the next few weeks in Selangor and KL as well, as more and more people receive their full 2nd dose and are considered fully vaccinated, which is 2 weeks after your 2nd dose.
37.5% of adults in Klang Valley have completed their vaccination. The COVID-19 Immunization Task Force, Khairi said, would now focus its efforts on vaccinating those who have dropped out, as well as those who did not register to get inoculated and those who may have cancelled their appointments. Opposition members of Parliament gathered at Merdeka Square today, calling for the opening of Parliament and the resignation of Prime Minister Tan Sri Muhyiddin Yassin. The protest was following the government's decision to cancel the final day of the Dewan Rakyat's 5-day special sitting, which has been postponed indefinitely due to COVID-19 concerns. Among MPs present were opposition leader Datuk Sri Anwar Ibrahim and former Prime Minister Tun Dr. Mahathir Mohamad, alongside a dozen of lawmakers from the opposition bloc. Anwar reiterated his call for the Prime Minister to resign, claiming that the ruling government has collapsed. The group tried to march towards the Parliament but were denied entry by police. The Parliament session has been postponed once again due to COVID-19 concerns, although questions have been raised if political reasons were behind the postponement instead. Taking a closer look on this issue from a public health perspective, what are the indicators used in deciding its postponement, and how can Parliament convene safely in the future, as it appears that the pandemic is here to stay? We speak to public health expert Dr. Muhammad Farhan Rusli.
When you shut down Parliament, I do not care whether you shut it down for political reasons. Let that be the reason for you to state why it's closed. But the moment you use data and science as a guide to shut down Parliament, it throws everything that we have done over the past 1.5 years in disarray. Because now you are going to make the public confused about what are the indicators for you to shut down a certain place, for you to cordon off a certain place. I can give you 10 places right now where they have 12 to 14% positivity rate and it's still open. Now you tell me about the cases in the PPV. How come you're not shutting down the PPVs even though you have cases which is more than 1%? How come you're not shutting down all the vaccination centers? Do you see the big ramifications that occurs when you do this without using science and data accurately and properly? And now people are going to question every single thing that you announce after this. Is the data correct? Is the science correct? Are you sure that what you're saying is truth? And because of what you have done, you have broken down any sort of trust that the public has in the pandemic response.
Dr. Farhan also stressed the need for a national testing policy that will set a precedent on how the government can begin to open up the country.
Definitely, number one, you need to develop a national testing policy. You have to decide who are you going to test, when are you going to test, how many times are you going to test, and what tests are you going to be using to be acceptable for you to say that this is confirmed positive. And this is 4 items that must be detailed out and must be implemented on the whole national level. And you cannot be picking and choosing where you change the policy, because when you do this, definitely you will never be able to exit the pandemic. The structure of what you are about to be doing does not shut down. And this is what we mean by opening up. And Parliament was the litmus test for us to see how we can actually operate normally at full capacity. And if we cannot even get this right with 222 people right, definitely we cannot even think about opening up any other sectors of the economy.
Political pressure continues to mount with no resolution in sight for the deepening constitutional crisis. Tonight on Consider This, we ask MPs how they view disputes over the suspension of Parliament and revocation of emergency ordinances. That's coming up after AWANI tonight. We'll take a short break. Stay with us. Welcome back. In Malaysia, some 3.1 million people, eligible adults, have yet to register to be vaccinated against COVID-19. As cases continue to rise, with many new clusters emerging from the workplace, what options do employers have to ensure a safe environment for employees when they return to the office? We asked Malaysian Employers Federation's Executive Director, Datuk Syamsuddin Badan, if mandating vaccination is an option.
There's no law that can mandate employers to force their employees to get vaccinated. But on the other hand, we also say that there is no law that actually disallow employers to actually ask their employees to get vaccinated. So this question is that if there is no law prohibiting employers to actually mandate their employees to get vaccinated, can the employers as a policy introduce a policy within the company to say that if you want to actually work in the company, if you want to come to the workplace, you must make sure that you are vaccinated. Otherwise, the company can say, look, sorry, I can't allow you to actually be at the workplace because you're not yet vaccinated. And I would say that if the company actually come up with that kind of policy, I would say that it is a reasonable policy.
He added Section 30 of the Occupational Safety and Health Act dictates that employers are responsible to ensure a safe work environment for all employees and clients. Under the same act, employees are also bound to ensure they are not a health hazard to other employees or clients.
It is, I would say, important for the government to actually come up with a proper policy on vaccination at the workplace. Yeah, and of course, I would say that in the event the government is able to come up with a proper policy on vaccination, then of course it's easier for the employers, it's easier for the employees, and so that actually we can come up with what we call it as a win-win situation, so that there is no, I would say, argument over the subject matter.
Datuk Shamsuddin reiterated that while waiting for government to come up with guidelines, companies should set their own policies to allow only fully vaccinated individuals to work in the office. On to international news. 8 people have been killed from wildfires in Turkey's southern coast as firefighters battle the raging blaze for a 5th day. Thousands of people, including tourists, were evacuated as wildfires spread to Greece, Italy and Spain too. Turkey, the worst affected, reported 2 more deaths yesterday due to wildfires in the southern town of Manavgat, with 10 more people receiving hospital treatment. Authorities said most of the more than 100 blazes that erupted in Turkey since last Wednesday have been contained, but fires are still raging in some coastal resort towns. Locals as well as support teams from Russia, Ukraine, Iran and Azerbaijan were deployed to help in the massive firefighting operation. The flames have been fueled by scorching temperatures and conditions that experts say have been worsened by climate change. Australia's 3rd largest city, Brisbane, has extended its lockdown due to increasing numbers of COVID-19 infection. This as Sydney started deploying soldiers in the city to enforce a stay-at-home order in a bid to curb the spread of the Delta variant. Brisbane's lockdown, which was due to end tomorrow, has now been extended till Sunday. The Queensland government announced the extension after 13 locally acquired infections of the Delta variant were detected in the past 24 hours. Sydney and surrounding cities in New South Wales are in their 6th week of lockdown, which will last until at least August 28th. New South Wales reported 207 locally acquired infections today. Meanwhile, some 300 army personnel who will be unarmed and under police command began door-to-door visits to ensure people who have tested positive are isolating at their homes in areas of Sydney. Singapore is allowing those who suffer from allergic reactions to the Pfizer-BioNTech COVID-19 vaccine to take a Sinovac jab as their 2nd dose. Senior Minister for Health Janil Puthucheary said in Parliament today that people who receive this mixture of COVID-19 vaccines will be considered fully vaccinated. The Pfizer and Moderna vaccines approved for use in Singapore's national program use messenger RNA technology. This is different from the Sinovac vaccine, which uses unreactive coronavirus particles to stimulate the body's antibody protection. The Sinovac vaccine is currently allowed to be administered in Singapore under the special access route after it was approved for emergency use by the World Health Organization, but it is not included in Singapore's national vaccination program. That is all we have for you on AWANI tonight. Get the latest news updates on COVID-19 and COVID-19 vaccines from astroawani.com and Astro AWANI app. I'm Cynthia Ng. We'll see you again tomorrow.